Okay, so I'm Blethen Rees again, and I'm going to introduce the next session, which is Unlocking the Potential of Health Data and Digital Tools. And some of you may think this is a strange title, that everybody understands what digital health is or health data is. But MWC has, and 4 years from now, have a substantial number of startups. So what we're trying to do is what I would call a bit of missionary work to explain to people some of the basics, as well as then talking a little bit more in some detail. So with me on stage, I have Julien Venn, who is a Frenchman living in Barcelona, and who used to work with the ECH Alliance in our early and formative years. And Julien is a distinguished academic and business entrepreneur. So we're going to have a conversation between us, answering some questions, and then he's going to use some slides to demonstrate some of the things that he's saying. So Julien, over to you.
Thank you.
So introduce yourself if you...
Yeah, well, you said it all. I was working for this organization during many years and being a board member during many years. I'm now a consultant and working on different projects on digital health mainly and health innovation at large.
So our first question is how data and digital tools are impacting healthcare.
So yeah, to start with perhaps a few obvious, perhaps for some, but not obvious for others, some use cases perhaps to understand where the data and digital technologies are impacting health at the moment. Actually, we are not talking about 4 years from now, we are talking about now, exactly now, or even for a few years ago. And I wanted just to highlight a few use cases, and actually the slides are meant to be just illustrative on what I will say. But of course we have different use at the moment. Here you have the case of Henry, who is a cancer patient, a patient in oncology. And if we want to develop personalized health or personalized medicine, or it has been called a few years ago, well, a decade ago, 4P medicine or 5P medicine, we need obviously to understand perfectly the situation and the intrinsic characteristic of this patient if we want to develop personalized treatment. So it could be personalized therapy, it could be a personalized drug, it could be personalized diagnostics as well, taking multidimensional way. We have as well the obvious remote monitoring approach where you have a chronic disease, for instance. Here you have Sarah, she has a chronic disease, she's at home, she prefers to live in her house, and she's monitored remotely by health professionals who can analyze a certain number of data. Healthy aging and seniors, our population in Europe, but it's not only the case in Europe, it's as well the case in US and in other places. Our population is getting old and older, and we have different strategies to cope with healthy aging, to increase. We have increased life expectancy, but the challenge now is to increase the good quality of life at the end of the life. This challenge can be reached thanks to sensors and data that we are collecting in an integrated manner most of the time. It has shown that it's more effective if we have medicine, but as well medical social services to bring to these people. So we see that for all the population, data is nowadays employed in healthcare, so obviously digital, and that's why we are here since 10 years, because digital and data are mainstream, I would say now, in healthcare. The challenge are other, I will speak later. Here it's an example of application as well in radiology. You take medical imaging. At each step of the workflow of a process imaging, you have intervention of digital solutions. Radiology and medical imaging has been one of the first sector to adopt digital and then AI in the previous years. It's nowadays kind of routine use. We have the the example of digital therapeutics that numbers of companies and pharma companies as well are developing beside the pill or beyond the pill. They have designed strategy to support better their patients, their clients, and we see a number of solutions on the market around that. And we have as well other type of technologies. Here it's an example of facial recognition. Oh, the video is not working, but basically this video is showing that nowadays with computer vision we can recognize the emotions on the face of somebody, and I had the chance recently to do a project in mental health and psychiatry using this in live consultation between psychiatrist and patients, so it's very useful for the psychiatrist. Last example in public health. Of course, COVID has helped a lot, in a sense, I would say. It's what we were saying the year after COVID. At the end, it has pushed for more use of data and digital, and the capacity to have geospatial visualization of this data is very useful for local authorities or authorities in general, public authorities. Here it's an example of a city I had the chance to collaborate with in Western Cape in South Africa. This kind of example, you have that in different cities. Barcelona is a good example as well. Melbourne in Australia is a good example. There are many cities who develop that, and the approach is very important. The only challenge here is to maintain that after COVID, and it's not always easy to find the credits for that.
Okay. So that leads me to the second question, which is how data and digital are transformative for healthcare.
So there are several aspects actually to take into account. We often present the data as a raw material for digital technologies in general and digital health in our sector, as we were collecting something tangible that would be compared to oil or to other type of raw material. Actually, a few years ago, The Economist had this front page about comparing data with oil, with the biggest data aggregator at this time. And actually, in a certain way, it's true that actually the value of data is increasing with the transformation you bring to that, like it would be for another raw material. Here I took the example of iron. A simple bar of iron has a value, but more you transform this bar of iron, more you will add value to that. It's a bit the same with data. More you work with the data, you improve it with machine learning or other type of technologies, you increase the value of this data. And actually the data in itself as a raw material has no value if you don't create information, knowledge, and which should lead to wisdom. We see that it's not always the case, but it's what is important now. And I like this Lego representation. I will come back to that. But the data is not something homogeneous. Most of the time is non-structured. In healthcare, I read it's about 75 or 80% in some studies of the data available in healthcare which are unstructured. So of course there is a lot of work of transformation if we want to make something of it. Where it diverges from a classic raw material is that when you use the data, it doesn't kill the data. So the data is reusable, which is not the case of the bar of iron I was talking about. You can recycle it potentially, but it's not as easy as data. It's not because you consume a data that this data is losing value. Actually, the value of the data is constant in the time. So it's important when you think about IT system or digital solutions to have this in mind. And actually, a data could be shared without losing value, which is important for the challenge we have. The other part, actually, my kids who review all my presentation told me, it's wrong, Dad, but he's right. But in the case of data, we have to think about the emergence we can have by the data analytics. So we extract more value analyzing the data, and so the 1 + 1 = 3 equation is very important to keep in mind as well when we design digital systems. Which data we are talking about? Here it's a big data. We have different aspects to look at it if we want to keep and increase the value of data. And if you don't have all these characteristics around your data sets, your data set has less value than another one. So it's very important to have a look on that. And then the superpower I was talking about is that with digital, you can think beyond space and time. Telemedicine, for instance, allow to go in very remote areas and deliver healthcare services in this area, and the time as well is the way. For instance, I was managing a company in medical imaging, and we were using remote radiologists to interpret during the nights the scan, and the space and the time is not anymore a problem. We can create digital twins, and so with these digital twins we can personalize. Really, I was talking about personalized medicine instead of having a one-size-fits-all model. So it's very important for policymakers or healthcare providers to think in this way when they develop their system. It's scalable. Digital is cheap. It's easy to scale. So it's a way as well. Actually, I put a picture of India where I lived recently, and we were talking about India before. This is Holi Festival, which will be next week. But in countries where you have a large population and sometimes a population which is difficult to reach with care centers, digital can be as well a solution. And there is a part of magic in digital with the predictive analytics. Magic is not magic, of course, it's mathematics, but it appears magic to most of the public. But it's a very interesting aspect to be able to be predictor.
Okay, so that leads me to the what are the current and up-and-coming challenges we think we face?
Yeah, well, the challenge is first is to identify what we are talking about health data. Actually, I don't like to talk about health data. I prefer to talk about health-related data or data useful for taking care of the health of people or health and well-being. Because actually, beyond the classic data we are all thinking about that you can find in a hospital, in a biobank, or in a care center, around the electronic health record, the EHR, we have new models on that. I will talk about it. But we have as well plenty of data to collect, because health is not only what we collect at the hospital or in a care center by health professionals. It's a sum of different aspects. You have here 4 main areas that are influencing and impacting health, like what we call the determinants of health, which could be social, political, commercial, corporate environments that could influence your health. And actually, more data we will collect, more able we will be able to develop this personalized approach I was talking about before, taking different data sources and not always the classic ones.
So the challenges then?
So the challenge is mainly roughly, because we don't have a lot of time, but I segment that in different actions. Actually, we have to do on data if we want to achieve what I presented before. First, we have, of course, to capture data. Here, the sector has developed a lot. We have millions of sensing capacities, and the sensing industry is improving every day with new sensors. I like the picture with the guy here because it shows that we can monitor almost everything on a human body from head to toes, and we have now a medical device, but we have as well in the cities data that are collected, sensors everywhere for the air quality, for the traffic, for the green zone. Different sensors are taken, and all of this is contributing to the health of the citizens of a city. Of course, all these data sets don't have the same quality. Here it can generate a lot of issues, especially when we develop ML or AI models. So the data quality is a real big challenge, and ICH Alliance has been very active with different partners on this subject of data quality. We have different attributes to qualify the quality of a data set, but it's an important point to take in account, because the quality is lacking. I was reading an article recently on real-world data used in regulatory approval for new treatments, and most of the time the RWE, the real-world evidence, are rejected for the question of the quality of the data, the completeness or the accuracy of this data is not always ensured, especially with medical devices that we wear. You were talking about your watch, for instance. Your watch is reliable if we believe Apple and the FDA, but not all the devices. Of course, once we have developed the models, the audit and bias detection is very important. This sector is not enough developed. There are multiple initiatives and experts actually around here I met this morning about this question of auditing AI models, and it's something that we have to work on. Colleagues were talking about the AI Act, and it's a really important point of this regulation. I would join my colleagues saying that regulation is not a barrier to innovation, but in this case it's enabling trust, because we know that these AI models are audited. Then there is a challenge of, once we have captured the data, to share this data across the board, across the different stakeholders participating to the ecosystems. And I come back to my Lego picture, borrowing this metaphor to the Open EHR Foundation that I wanted to mention, has a remarkable efforts to develop new standards and new way to organize and arrange data in IT system in healthcare. It has been active since more than a decade now and very active in implementing. And for instance, here in Catalonia, the government made the choice to invest in this manner to develop and to manage the data. And it's really, in my opinion, the future, because it enables this data sharing more easily and contribute to the interoperability beside the classic standard we have in the industry, like HL7, for instance. Then a big challenge is the interaction with data. Nobody wants more Excel or random interface, but we want to interact easily with the data. So generative AI bring us a series of solutions to interact more naturally with data, both for professionals involved in the care, professionals involved in the management. I didn't mention that, but actually one of the big advance or big progress thanks to AI in healthcare is first the management of the health system and management of healthcare providers, not only in the care activity, but as well in the management of these kind of organizations. But the interaction with data through voice or through a natural interaction, even for patients. Recently, a Barcelona-based company, Social Diabetes, presented a new version of their product with the interaction between the patient and the tool, which was an app before, but the apps are dead, are saying some people. But the interaction with my data as a patient is very important, and now we have solution for that. Of course, we have to regulate and protect. So we talked about a GDPR, I will pass. We have technologies as well enhancing this privacy. I talked about the PETs, the privacy enhancing technologies like differential privacy and synthetic data, which could be a good opportunity for development of AI models and digital solutions for healthcare as well. Of course, there is a question of power and trust. GDPR introduced the consent concept, but do we have the choice, I would say? So the imbalance of power could create problems here. The access to data is the main challenge at the moment. I will finish on that. We have different systems that could be centralized, decentralized, or hybrids. The question is not necessarily this one, the important one, but because it depends where you are looking from. So a decentralization approach like Europe around the European health data space, which regulation should be published today or tomorrow.
Today, it's been published today.
Been published today. So it's a decentralized approach if you look at the European scale, but if you look at the national scale, it's more centralization of data somewhere. So the question of decentralization is very important, but it's a huge step for Europe, very important step as well in terms of regulatory environment. I will pass on that. And I wanted to finish on the responsibility as well we have, because the concentration of data into certain players or certain companies, in some case, is bringing politics on the stage. And actually, when we have companies starting to do politics, I just recommend this book from a French scientist, very interesting about a relation between technology and politics. We have to be careful because we can misuse the data, let the data tell something that we have decided ourselves, or the conspiracy theory, for instance, which led to post-truths. And the last challenge I was mentioning here is footprint, environmental footprint of digital AI, and we talked a lot about that this last week and in the summit in Paris around AI. It's very important to have appropriate use of digital and AI when it's useful, and not for the hype or the good-looking aspect of technology, but where it's very useful and very impacting for health. This slide is sponsored by my two boys. They told me I had to finish with Spider-Man, so I will engage everybody to use this great power with great responsibility. I think it's important, given the challenge I just mentioned.
Julian, thank you very much. I hope that's set the scene for later sessions today around data and data uses. So thank you very much.